Welcome to the Deep Dive. Today we're really getting into something important, how aerobic exercise affects high blood pressure or hypertension.
That's right. We've looked at a lot of research, specifically a big review combining results from 34 different trials.
Yeah, think of this as your shortcut. We want you to get a solid grasp on how moving more can impact your blood pressure numbers without getting totally lost in the science.
Exactly. Your mission, should you choose to accept it.
Is to walk away with some clear, actionable insights.
And here's something interesting right away. The research points towards, well, a kind of sweet spot.
A sweet spot for exercise.
Yeah, a specific amount of weekly aerobic exercise that seems to give the biggest drop in blood pressure. Doing more doesn't necessarily mean better results, which is kind of surprising.
Okay, that definitely goes against the usual more is always better thinking. Let's unpack this.
Let's do it. Our goal is really to pull out the key findings for you, make it useful.
So maybe start with the basics. What is hypertension, according to the study's context?
Good idea. So the definition they use comes from the American College of Cardiology and American Heart Association. It's basically a systolic pressure, that top number of 130 or higher,
Okay.
or a diastolic pressure, the bottom number of 80 or higher. Or, of course, if you're already taking medication for high blood pressure.
Right, and this isn't a minor issue, is it? It affects a huge number of people.
Huge, globally. And it's a major risk for serious things like stroke, heart attacks, really significant health consequences.
Which brings us to treatment. Lifestyle changes are always mentioned, right? Exercise comes up a lot.
Absolutely. And this research really underscores that. Physical activity, particularly aerobic exercise, is presented as a cornerstone of therapy.
A cornerstone, okay.
Yeah, and interestingly, the review suggests that exercise can be, just as effective as many blood pressure drugs.
Wow, really? As effective as medication?
In many cases, yes. And often with fewer side effects, which is a big plus.
Definitely a plus. So what did this big analysis find overall? What was the general impact?
Okay, so looking at all 34 trials together, they found that for every extra 30 minutes of aerobic exercise per week, systolic blood pressure dropped, on average, by about 1.78 millimilli-G. The certainty for that was rated low, by the way, using the grade system.
Okay, 1.78 systolic and diastolic.
Diastolic dropped by an average of 1.23 millimilli-G for every 30 minutes. That had moderate certainty.
Interesting. And what about heart rate? Did it affect that too?
It did. They saw a small dip in resting heart rate, about 1.08 beats per minute lower, again, on average. That was also low certainty.
I mean, arterial pressure.
Also a reduction there, about 1.37 millimilli-G, low certainty again.
So it seems like even, adding some regular aerobic activity helps push things in the right direction.
Exactly. Every bit seems to count based on these averages.
But you mentioned that sweet spot earlier, this dose response idea. That sounds like the really juicy part.
It is pretty fascinating. They described it as a nonlinear dose-dependent effect.
Okay, nonlinear, meaning it's not just a straight line where more exercise always equals more benefit.
Precisely. Think of it like, well, watering a plant, maybe. A little water helps it grow fast. More water helps too, but at some point, adding even more water doesn't really speed things up and might even be unhelpful.
Okay, I get that analogy. So where was the sweet spot for blood pressure?
The analysis found the greatest average reductions in both systolic and diastolic pressure occurred right around 150 minutes of aerobic exercise per week.
150 minutes. That's the magic number.
It seems to be, according to this data, at 150 minutes, the average drop was 7.23 millimilli-G for systolic.
Wow, that's quite a drop.
And 5.58 millimilli-G for diastolic. That's a clinically significant reduction.
Absolutely. So the big takeaway here is you might get the most blood pressure benefit around that 150-minute mark.
That's what this suggests. You might not need to push for hours and hours more, specifically for blood pressure lowering.
So 150 minutes, like we said, that's roughly 30 minutes, 5 days a week. Seems achievable for many people.
It does feel more accessible than, say, thinking you need to do double that.
Yeah. But what happened if people did exercise more? Did the benefits keep increasing past 150 minutes?
Well, that's the nonlinear part. The study indicated the effect kind of plateaued. Yeah, or even slightly decreased beyond 150 minutes per week. So more wasn't necessarily better for lowering blood pressure further based on these findings.
Huh. And did that hold true even when they look at specific exercise intensities, like moderate exercise?
Good question. They did look at that when they ran a sensitivity analysis focusing just on moderate intensity aerobic exercise.
Which is like brisk walking. Getting your heart rate up, but you can still talk.
Exactly. Things measured by MET-T's metabolic equivalence or as a percentage of max heart rate. And yes, even focusing on moderate intensity, they found very similar results.
So the biggest drops were still around 150 minutes.
Correct. For moderate intensity, it was an average drop of 7.32 millimilli Hg systolic and 6.53 millimilli Hg diastolic at 150 minutes per week.
Yeah.
Very close to the overall findings.
Okay, so that 150-minute sweet spot seems pretty robust, at least in this analysis.
Right.
Now, they didn't just look at blood pressure taken in a clinic, did they? What about readings throughout the day?
Right. They looked at ambulatory blood pressure monitoring, which tracks it over 24 hours.
And what did that show?
They found small reductions associated with exercise. For every 30 minutes weekly, 24-hour systolic dropped by about 1.55 millimilli Hg and diastolic by 0.72 millimilli Hg, both low certainty evidence.
Yeah.
And daily diastolic also showed a small drop, around 0.78 milliliter Hg, again, low certainty.
But not everything changed significantly with ambulatory monitoring.
Correct. They didn't find significant changes for daily or nightly systolic ambulatory BP or for nightly diastolic BP.
That's interesting. So the effect might be more pronounced during the day, maybe?
It's possible. Perhaps the effects are clearer when we're active. But again, the low certainty rating means we need to be cautious. More research is needed there to really understand those nuances.
Fair enough. Did they look at different types of people? Like, did it matter what kind of exercise they did or if they were on medication?
They did do subgroup analyses, and what was quite interesting is that the benefits seemed pretty consistent across the board.
Consistent. How so?
Well, whether it was different types of aerobic exercise, different intensities or durations studied, people's weight status, whether they were taking meds, or even if the exercise was supervised, the positive trend was generally there.
That's good to know. Broad applicability.
Yes, but with a caveat, most of the trials included focused on walking, running, or jogging.
Ah, okay. So maybe less data on things like swimming or cycling specifically.
Exactly. We have less information from this specific meta-analysis on how those might compare in terms of dose response.
Got it. And beyond blood pressure, what about other health markers? You mentioned resting heart rate earlier.
Yes, resting heart rate showed a clearer dose response, actually. It tended to decrease more as exercise duration increased.
Oh, so more exercise did lead to a lower resting heart rate.
It seemed so. They noted a substantial reduction, even around 100 minutes per week of moderate intensity exercise.
Okay. And other things,
Yeah.
like maximum heart rate or cardiac output.
For those, the study didn't find significant effects based on the exercise interventions. Same for peripheral resistance and pulse pressure.
Right. And quality of life. That's so important for overall well-being. Did exercise seem to help there?
There was some evidence, yes, though they rated the certainty as very low.
Very low certainty. Okay. But what did it suggest?
It suggested potential improvements in things like bodily pain, physical functioning, role emotion, which relates to emotional well-being in daily roles, and also vitality or energy levels.
So it's not just about the numbers on the cuff. It might actually help people feel better day to day.
That's the suggestion, yeah. Which is great to see, even if the evidence needs strengthening.
Definitely sounds like a lot of positives.
Ah.
But like all research, there must have been some limitations mentioned.
Absolutely. They were upfront about several things. One was heterogeneity, basically. The results varied a bit between the different studies they included.
Okay, not perfectly uniform. Makes sense.
Right. There was also the potential for publication bias. The idea that studies showing positive results might be more likely to get published than those showing no effect.
Always a possibility in these kinds of reviews.
Indeed. They also pointed out the limited number of studies on certain exercise types, as we discussed, and the need for more research on long-term effects.
Long-term effects, yeah, that's crucial.
Yeah, and as we've mentioned, the grade certainty for some outcomes was low or very low. Plus, most studies didn't really report on any adverse events or negative side effects from the exercise.
So still some things we don't know for sure, or areas for future research.
Definitely. Science is always an ongoing process, but this analysis gives us a pretty solid snapshot based on current evidence.
Okay, so let's try and boil this down. If someone listening has hypertension or is maybe concerned about it, what's the main takeaway message from this deep dive?
I think the core message is that regular aerobic exercise is clearly beneficial. And specifically, aiming for around 150 minutes per week seems to hit a sweet spot for achieving a clinically meaningful drop in blood pressure.
That 150-minute mark again.
Yes. And importantly, Doing significantly more than that might not necessarily add much extra benefit, at least specifically for blood pressure reduction, according to this data.
It's about finding that effective dose. And this isn't just one study's opinion, right? This comes from pooling data from many trials.
Correct. It's a synthesis of 34 randomized controlled trials involving nearly 1,800 people with hypertension. It gives the findings more weight.
So for you listening, this gives you a shortcut to understanding quite a bit of research. What should you be thinking about now? Maybe how to apply this?
Yeah, I think the immediate thought is, how could you weave about 150 minutes of aerobic activity into your week? What would that look like for you?
Good question. And maybe thinking about consistency.
Absolutely. Consistency is key. And it also opens up a conversation to have with your doctor.
Right. You could discuss these findings, see how they fit into your overall health plan.
Exactly. Talk about what type of aerobic exercise might work best for you, something you'd actually enjoy and stick with. Brisk walking, cycling, swimming, dancing, whatever gets you moving.
Finding something enjoyable makes sticking with it so much easier.
It really does. Because adherence is probably the biggest factor in the long run.
That's great advice. It's a personalized journey, but this research gives a really useful target to aim for.
It does. And of course, research keeps evolving.
Always. Our understanding of exercise, health, hypertension, it's constantly being refined.
Absolutely. Future studies will undoubtedly add more detail, perhaps look more closely at different exercise types or longer-term impacts. But for now, that 150-minute mark is a really helpful piece of guidance.